Hello, and welcome to the National School webinar about the STP Curriculum Review Project and the launch of the new STP Curriculum. I'm Steph, and I'm the Curriculum Project Support Officer for the National School. Today's webinar is just one of the ways we plan to support you through the change of curriculum ahead of September 2022. Today's webinar will be recorded and available on our website if you would like to watch it back or share with your colleagues. Throughout August, we will be holding a couple of specialism-specific curriculum webinars for histopathology and clinical engineering. We will also be holding a number of drop-in sessions for training officers to come and ask the curriculum team questions. The details of these are on our website. And we are also available via our email address, nshs.curriculum@hee.nhs.uk. In today's webinar, we have three speakers: Dr. Navina Evans, HEE CEO, Professor Bernie Ferry, Head of the National School of Healthcare Science, and Dr. Chris Fisher, Head of Curriculum. I would now like to hand over to Bernie. Hello, Bernie.
Hi everyone. Thanks, Steph, for the introduction. I can see that there's lots of attendees here today, and I just want to welcome all of you. I mean, individually and collectively, I welcome all of you to this webinar. And this is such an auspicious day. It really is. It's a day that's been a long time coming, and I cannot tell you how pleased I am, and the school is, and I have no doubt that most of you are as well. So pleased to be here today. And every one of you, every single one of you, deserves a pat on the back or a glass of champagne or whatever it is you want to do to celebrate, because we've all done this. It's been organised and orchestrated through the curriculum team at the school, but it's really been you that's done it, and just massive congratulations. And I'm going to kind of warm to that theme as I go through. It's taken all of us 2 years to get to this point, and it's been an incredible 2 years. It would have anyway been a hard 2 years, and in any case it would have been difficult. But the fact that we've done this, that all of us have done this during COVID, you know, and all of you work in acute hospitals or in hospitals that may not be acute, but they are very busy. You've been disrupted by COVID in your work. You know, your families have been affected by COVID, your friends, your personal lives have been affected. And yet, you know, we have actually kept on track and delivered these 30 new curricula. We embarked in this journey together, and I think it's only right and proper that we celebrate it together. And this curriculum launch webinar is definitely a celebration of the really hard work and the innovative work and just the incredible amount of work that you've all done. This curriculum review came directly out of the STP review, when all different scientific disciplines right across the board inputted into that review and asked for this curriculum, for all curricula to be brought up to date, to be made fit for purpose for the future. And so, you know, we've all worked with that feedback. Chris and her team have really worked with that feedback and helped to fashion curricula for 30 different disciplines that is really fit for purpose. It's remarkably flexible, that, you know, works across hospital curricula and also the academic curricula, and that is the envy, quite frankly, of everyone else in Europe and probably across the world. You know, I cannot tell you just how unique this is. We together have managed to develop 30 new different scientific curricula, today we're kind of making that curricula go live, and do not underestimate that feat. There's nobody else in the world that's done this. You know, we have in this country, we've got Royal Colleges, and those Royal Colleges at any one time may be coping with, I don't know, 3, 4, maybe 5 even curricula. The biggest number of curricula held by a Royal College is that of the Royal College of Pathologists, but they hold no more than about 13, 15, and they never, ever do them all together, and they never try to bring them together as a community of pathologists. But what you've done, what you've managed to do here today, led very well by Chris, is that we've managed to produce a cohesive, a standardised, a really modern curricula that is fit for purpose in a modern world and in a very modern and rapidly changing NHS. What you've done with the curricula is you've made it very flexible and very nimble, so that if we have to go in to change any of your curricula anytime in the future, it's going to be much, much easier to do so. And what it's really done, I believe, is it's brought us all together as a community of healthcare scientists in Britain, and certainly it's something that's, we've been working on this for many, many years together, but the launch of this curricula really shows that we are a united community of healthcare scientists in the United Kingdom, and that's something to celebrate. It really is. And I'm going to probably leave it there and just say a massive thank you. I mean, really, really massive thank you to all of you for your hard work and for your engagement, and for wanting to be part of this community of scientists that we've now got in the United Kingdom in healthcare science. So thank you, congratulations, and I hope you really do celebrate and enjoy the rest of this webinar. Thank you. Over to Chris.
Good afternoon, everyone. So for those of you I haven't met through this project, I'm Chris, and I look after the curriculum for the National School. And I'm absolutely thrilled to be with you this afternoon to launch the new STP curriculum for 2022. So I can't really express what this project means any more eloquently than Bernie has done before me. However, I do want to add my personal perspective to that. I think, first of all, I just want to say that it's been an absolute pleasure to work with everybody that's been involved in this project. It really has. And it's been an absolutely fascinating journey for me to find out more about all the specialties and learn what it is you get up to on the day-to-day. And it's been truly mind-blowing for me to realise the vast wealth of expertise that resides out there in healthcare science with you. It's been absolutely mind-blowing. And as Bernie mentioned, the thing that has overwhelmed me most has been your continued commitment to this project. When we started this project, we were in quite a different time, and it has been a huge journey over the last couple of years. But despite everything the last 18 months has thrown at us, everybody has continued with this project, and that commitment to the future of your specialties for me has been utterly overwhelming. So I want to say a huge thank you to everybody that's been involved in this project. And as we're here to launch today, I should also say a huge thank you to everybody who's going to be involved in the next stage of this project and is going to be involved in putting this hard work into practice and getting these curricula out there and making them live. So thank you to everybody in advance as well. So I'm going to talk briefly about the project this morning. Bernie's given us a quick recap and I'm going to just carry on from there. And then I will talk you through the curriculum, where you can find it, and a little bit about what might have changed and what you might need to consider. So first of all, just to recap on the project. As Bernie mentioned, everything we've done has really followed on from the STP Improvement Review, which was completed back in 2018. So that was a huge opportunity for you to give us your thoughts, your comments, your feedback on the STP. So what you told us was that the curriculum structure was about right, but you did tell us there were some other areas of the curriculum that weren't quite working so well. And that's what we've taken forward into the curriculum review project. We've kept that structure as it was, and we've worked on a few of the areas where you told us things weren't quite working so well. And I'll talk about those a little bit later on. So we started this project back in 2019. And our first step was to appoint our lead editors. We then brought together our curriculum review groups, working with our lead editors to bring together groups of you for each specialty. And we set a question to each of those groups. This will be very familiar to those of you who are involved in these groups. We asked you to consider what you would like from from somebody starting day one on the job, what you would expect from them. We asked you to consider the essential skills and expertise that you would expect from the threshold clinical scientist right at the beginning of their career. And we use those answers, the answers to those questions, to draft our curricula. As you may remember, earlier in the year, we made those draft curricula available to you for your feedback, for your thoughts, through our stakeholder review process. And so many of you contributed to that. I'll talk about that in a moment as well. And that brings us here today to our curriculum launch, which I really can't express how thrilled I am to be with you today to launch these curriculum. And takes us forward to next September, when you'll be able to put these curricula into practice. So having mentioned our lead editors, I do need to say a huge thank you to everybody who stepped forward to lead their specialties. Through some challenging conversations, through pressures and commitments elsewhere, you've taken these specialties forward to develop this new fit-for-purpose curriculum. So thank you so much to all of our lead editors. It has been a pleasure to work with all of you through this project. I also need to say a huge thank you to everybody that contributed to the stakeholder review, to all of you who provided your input. This has been vitally important for us in developing the final curriculum. It was very important to us to know that it would work for as many of you as possible. What you can now see on our website, and I will show you where to find this in just a few moments, is our response to your feedback. So this is available in the curriculum tracker for all of the specialty curricula. We've provided all of your feedback and how we've worked with that to develop the final curricula. This is available for all of the specialty curricula at the moment and will follow for the core curriculum shortly. I do need to express a special thank you to everybody that contributed to the core curriculum. We had huge numbers of feedback, which was incredibly informative for us in developing the last stages of the core curriculum. So this response will follow shortly, and you'll be able to see that on the website as well. One more thank you I do need to say is to our curriculum team and everybody that supported us at the school. So curriculum team, past and present. So to Virginia, who joined us to facilitate all of those curriculum review groups and has now moved on to her new role as Professional Standards and Improvement Manager, keeping us all accountable in the school. And I'm so thrilled that Steph's able to join me to host today as well. So while the school is celebrating its 10th birthday, Steph is celebrating her 11th year with the school. And while I am here doing most of the talking, I think there is no illusion that Steph has been the one that has been keeping me organised, keeping this project moving forward, and has worked, quite frankly, some small miracles along the way. So thank you, Steph, for everything you've done. So I'm briefly going to summarise what I'm going to talk about this afternoon. So first of all, I'd like to launch the new curriculum with you, and I'll show you where you can find that. I'm going to talk about what's new for 2022, so the areas that might look a little bit different. And then I'm going to talk about what it is you need to do now while you're considering taking a trainee for 2022. So without further ado, the new curriculum is now available on our website. As you might expect, it's available in the curriculum library. We've been doing some work on the curriculum library to make sure it's usable, to make sure it's accessible to everybody. So it does look a little bit different, but it has all the functionality you've come to expect from the curriculum library. So as you can see in that top left tab, the 2022 curriculum is now available in the curriculum library. I should just highlight at this point that these curricula have been hugely overhauled. So please do check the details in the curriculum library for your new curricula. Some of the words may be familiar to you, but they may appear in different places. So please do make sure you're using the most up-to-date copy of the curriculum, which will always be in the curriculum library. You can see on the bottom right tab there as well that you can access our STP Curriculum Review Tracker. As I mentioned a moment ago, this is where all our stakeholder review feedback will be hosted, and you've been able to follow along the journey of curriculum review through that tracker. I should just mention on the bottom left there as well, you can see that we continue to host the current STP curricula on the curriculum library as well. So if you have a trainee with you currently, if you have a trainee starting with you in 2021, they will continue to follow the existing curricula, which will continue to host in the curriculum library. The new curricula will be delivered from 2022. So even though Curriculum Library looks a little bit different, it does still have all the same information you can expect. So just to save you writing down a URL, you can access the Curriculum Library from any of our school web pages. If you scroll right down to the bottom of the page, there's a Useful Tabs link which features the Curriculum Library. Even though the appearance has changed, all of your bookmarks, all of your previous links should still work and redirect you as well. So in the Curriculum Library, you can still see all of the specialty information. So you can see there andrology as the top of the alphabet, including the core modules and the rotation modules and the specialist modules a little further down the page as well. You can still see all of the module information as well. We've included a summary of the module. We've included the work-based content, the clinical experiences, the academic content, and you can now see which specialty each module relates to. So all of the information you need on each module is included in the Curriculum Library. Most pertinently, this is still the place to go to find the details on your competencies and your assessments for each of the modules. All of those will be included in the Curriculum Library. So I'm going to talk briefly about what's new for 2022, which does have a lovely ring to it. I'm going to talk briefly about the rotations. So you told us in the STP improvement review that while rotations were a great thing, they weren't quite working as well as we'd like them to. So we've done some work there. We hope to solve some of those problems. I'm going to talk briefly about the competencies, still as you would expect, providing workplace training, but they'll look a little bit different in future. I'm going to talk about the core modules as well, and particularly about the individual professional development module, which I'll come to in a moment. And then talk briefly about equality, diversity and inclusivity and the impact that that has had on this new curriculum. So I'm hoping I'll be able to share this short video with you to explain how the new rotations work. Bear with me one moment. So I hope that that's summarised for you the new rotation module that we'll be taking forward. There we go. In summary, each rotation will be a minimum of 4 weeks and a maximum of 8 weeks in length. The aim is to support trainees to develop an understanding of the role of clinical scientists and the multidisciplinary team in their own and related specialties. For trainees to develop transferable knowledge and understanding in the specialties they'll be working with throughout the training and hopefully through the rest of their careers. We've redeveloped the rotation module, and you can see the new learning outcomes there, and we've applied this module across the specialties. So I want to talk briefly about the scheduling of rotations, because as you'll notice, that timeline is a little bit different to our existing curricula, with a minimum of 4 weeks and a maximum of 8 weeks expected in a rotation. So I'm sure you've done some maths there already. The STP continues to be a 3-year programme. First year will now include the rotations, but will not be exclusively rotations. Second year will continue to focus on specialty training, the project and all the other elements of the curriculum, as well as the third year. However, this does give you a little bit more flexibility in your first year in the scheduling of your rotations. So your first year of training may look a little bit like this. It may look a little bit like this. It may look more like this. I know that many of you are at the mercy of logistics of other departments, of making those arrangements for other places to host your trainees, and we hope that this new rotation module will make these conversations just a little bit easier. I suspect in reality, your first year of training may look a little bit more like this. And as you can see, there are some gaps in that first year of training. So what we hope you can do is begin to start that specialty training. Might look a little bit like this, might look a little bit like that. You have a little bit more flexibility to schedule your training plan in a way that is fit for purpose for your department, for your trainee, and for your training. So to support you in scheduling your training, we have introduced some new information to the curriculum library, which you can see here. We've introduced the idea of phases of training. So as you can see here, your rotations are the first phase of training. And then within your second specialist phase of training, you have a second and a third phase of training. So your training will begin to look a little bit like this. So as we reviewed the curriculum, we were really conscious to use the whole of those 3 years to develop the skills and the expertise that trainees need to be ready for day one on the job. So skills develop throughout those 3 years. We have phase 2 modules, specialty modules, where trainees will begin to develop their specialty skills, and those will be consolidated in phase 3 modules, where trainees will bring together the expertise they developed in phase 1 and phase 2 of training. So these form building blocks, these form the foundation to the previous stage. So while I appreciate real life doesn't quite happen in this linear fashion, we are recommending that you approach training in a phased order. It may be that you can start to approach some phase 2 training earlier, and it may be that you need to take a little bit longer as your trainee consolidates those skills from their phase 2. So talking of consolidating skills, I am not doing a very good job of handing over here, because I'm very pleased to say that we have our CEO with us, I believe. Yes. So I'm going to hand back to the team just briefly so that Navina can talk to you.
We're delighted that Dr. Navina Evans, Chief Executive of Health Education England, has been able to join us today to celebrate the launch of the new Scientist Training Programme curriculum, and to thank everyone that has played a role during the review project. I would now like to hand over to Navina. Hello, Navina.
Hello everyone. Thank you so much for having me. I'm seeing on the in the corner there that there's something like 400, more than 400 attendees. Yeah, that's fantastic. Probably more than that even. That's wonderful, and thank you so much for giving me 5 minutes of your time to talk with you. So I'm really pleased and excited to learn more. This is a new world for me, what you do, in the background, often quietly, and hugely important work that supports health and care, not just in England, but beyond, actually. That's such an important area of our work that most of us don't kind of remember or think about or recognize, but we really couldn't do without. So I'm going to say a couple of things about sort of who I am and my background, and then why I think that this is so important, and I'm so glad that we are where we are right now. So I'm Navina, Chief Executive at Health Education England. I've been with HEE since October of last year. I am a clinician, I'm a child and adolescent psychiatrist, and I have worked in clinical practice for a very long time. And then I became a kind of manager, a clinical leader, and ended up being chief executive of a provider organization before I came to HEE. So I kind of have been in the real world, if you like, which is the world that you all occupy. And I think that over the last year and a bit, this time that we've all been through, which is words have been used like unprecedented, nothing we've ever known before, what's uncertainty about the future. We don't really know if we'll ever get back to how things were before, what's normal going to look like. And there's lots of kind of anxieties around that. But the flip side of that is also there's an opportunity to really think about how we live, who we are, communities, and well-being. And I'm really interested in that notion of well-being and the impact that healthcare science and all of the work that we do has on well-being of our populations and our communities. Now in HEE, we're very focused on the population of England, but really a lot of what you learn will apply to other parts of the United Kingdom and beyond, the rest of the world. The reason I'm late is because I've just coming from a cross-government meeting around global healthcare. And your work in science and what we're learning is going to be huge in the global healthcare space. One of the things that we've learned through this pandemic is that we have lifted the lid on some of the not so good stuff, on health inequalities, on problems in population health. Some of it's actually quite shameful. Areas that we thought as a country, as a nation, that we were doing quite well, actually hasn't been that good. On the other hand, we've also learned about amazing innovation and amazing advances in science and technology, etc., that have really helped us to think about what a potential future could look like. Many of the things that used to be thought of unattainable actually could be within our grasp. And so this curriculum launch, which is a future-focused one, and I need to get to understand a little bit more about the detail of it, but from what I've heard, you're either really, really super clever, people who pull this together, or extremely lucky, because it feels like it fits for what we need for the workforce of the future. And I think that is hugely exciting. So all of you who are going to be part of this, working through this new curriculum and giving lots of feedback, always give feedback about what's working well, what could be improved. I think it's a living thing, so it's always a chance to iterate and learn and make it better. And hugely encourage you to take full advantage of the fact that through a digital way of working, the world is a very small place. So there are huge opportunities to exploit for your learning and your training. So with that in mind, I'm really excited to be here at the start of this launch. I really want to follow how it goes and get sort of tutorials from time to time, because there's quite a lot about it that I don't actually understand, but I will want to learn from you and to hear about all the good work that you're doing. So well done. Thank you very much, and good luck.
Thank you, Navina, for joining us today, and to thank the healthcare science workforce for their contributions to the curriculum review project. I would now like to hand back to Chris to continue her presentation on the new curricula. Hello again, Chris.
Thank you, Navina. I'm thrilled you've been able to join us today, and it's certainly been uppermost in our mind to make sure this curriculum is fit for purpose as we've been developing it. And we're considering all of those elements. I will talk about that a little bit later on, if I may. So I did get a little bit excited there to see that Navina was able to take a break in her schedule and join us. So I will just recap briefly. We were talking about rotations. So for the 2022 curriculum, our rotations will be a minimum of 4 weeks with a maximum duration of 8 weeks, which leaves you with more flexibility in that first year of training to begin your specialist training. So to support you in developing your training plan, we've introduced some new information to the curriculum library, which is phases of training. So rotations constitute the first phase of training, and within the specialist phase of training, we have phase 2 and phase 3. So those are there to help you develop your training plan and to help your trainees understand how they should be progressing through their training. So it leaves you with a training plan that looks a little bit like this. Trainees should be entering on phase 1 of training. We're looking to, if possible, complete as much of that first phase before moving on to our second phase of specialty training, and again through to our third phase of specialty training. So as I mentioned, I do appreciate that life isn't this linear, it isn't this straightforward. So these are there to guide you in providing your training. So these are building blocks that each phase provides the foundations to the following phase, provide the essential skills and knowledge that a trainee needs for day 1 on the job as a clinical scientist. So just to talk briefly about competencies, as I mentioned, you can still find all of the competency information in the curriculum library. It should still look very familiar to you in the setup. You can see here some of the competencies from one of our new core modules. And we are still providing that additional information for you within the competencies. However, it is framed a little bit differently for this curriculum. What we've provided here are some considerations. Considerations are there to support you in completing the competency, and they are exactly as suggested. Some things you can consider while completing this competency. I do want to be clear here, this list is not exhaustive. It's not exclusive, and it's not directive. It is a starting point for this competency. It is the signposts, just to get you started on the journey through this competency. So, in considering some of these elements, you may find they do not occur in the situation you find yourself in to complete your competency. You may find there are other things you need to consider. And this information is there just to get you started. So you may have recognised that competency from one of our new core modules. So I want to talk briefly about the core curriculum. So as I mentioned, you told us that the structure of the STP was about right. So we've worked with that structure, but reframed within that. So in the core curriculum, we now have the Professional Foundations of Healthcare and Clinical Science module. This continues to include both the workplace and academic elements, providing all of those cross-cutting skills, experience and knowledge that all clinical scientists need. We have the Research Skills in Healthcare Science module, which, as it suggests, will provide the research skills for trainees to go on and complete their STP project. We've also included this new module, the Individual Professional Development module, and I'm going to talk about that a little bit more for you. So again, I hope to be able to share this video with you. So I hope that explains a little about the new module for you. So in summary, this module is an opportunity for trainees to develop their own practice. While the curriculum provides the essential skills and knowledge required by all trainees, there are always going to be areas of practice that a trainee may want or need to follow up on. Say they have a particular area of interest. Maybe your department is a centre of excellence in a particular technique. You're developing new practice or innovating, and your trainee would like to get involved in that. This is their opportunity to do so. So the module asks that a trainee identifies a development need and identifies an opportunity to meet that need. It can be a single event or it can be multiple opportunities throughout training. We're encouraging trainees to take personal responsibility for their continuing professional development. Completion of the STP programme provides eligibility to register as a clinical scientist. And in order to maintain that registration, there are a number of things you need to do, which includes continued professional development. In order to provide the best service for our patients, our trainees, once clinical scientists, will need to continue to progress their skills, their knowledge, and develop their careers. And we hope this module gives them an opportunity to begin that journey of their own. So I want to conclude by talking about an area that is vitally important to the curriculum: equality, diversity, and inclusivity. So this always has been an element of our curriculum. We want to showcase the NHS Constitution and those NHS values through our curriculum to ensure we are upholding those values in everything that we do. We are holding those patients central to all of our practice. Our aim is to focus trainees on providing care centred to individual patient needs. It sounds quite small when I say it like that, but obviously this is a huge area, and that does include how we work together to provide that care to patients. We heard you loud and clear through the STP, through the stakeholder review, that you thought we could do more here. So we have made some changes. We've introduced new competencies focusing specifically on these areas and new topic areas such as equality, unconscious bias, health inequalities, and challenging behaviours. As Navina mentioned, there have been many events in the last couple of years while this project has been progressing that have really reframed our thinking in so many different ways. This area has been a huge conversation for us as we've been working through this project, and it will continue to be a topic of conversation for us. And I just want to conclude that I'm talking about today as the conclusion of this project. And as Navina mentioned, these curricula will continue to grow and live lives of their own. So we've put a lot of time, energy and effort into developing an adaptable and a future-proof curriculum, which we hope will serve well. And once this curriculum is in practice, we aim to continue that and to keep these curricula up to date. I've borrowed this slide from Bernie and it showcases some of the future technologies, and I have to admit, some of which I can't quite wrap my head around. As healthcare scientists, you are leading this future, and we need to make sure these curriculum are held, continue to stay up to date and deliver the practice that you need. So, you now have the new curriculum with you. So I want to talk very briefly about what it is you need to do now. So the first step is the commissioning process to host a trainee for 2022. First step in that is expressing interest in a trainee. We're expecting the expression of interest to be circulated very shortly, and that will be open with you until October. So first things that you can do: have a look at the 2022 curriculum, get familiar with it, start to think about how you're going to deliver it. As we've mentioned, rotations have seen quite a lot of change through this project, and that may include the specialties who you will be rotating to. You might need to start some new conversations there and develop some new relationships. So please have a look at those rotation specialties and start those conversations. And that will help you start to gather the information you need from the expression of interest. Now, I'm aware that the expression of interest may not come to you all individually. It may be that your trust organises a response to the expression of interest and to the commissioning team. So if you haven't heard anything in the next couple of months and you are keen to have a trainee from 2022, please do reach out to your lead healthcare scientist and make sure they know this. Hand in hand with the commissioning process is the accreditation process. So what you need to do now, if your department is not accredited and you would like to host a trainee for 2022, starting on this new curricula, please confirm those plans with your department. And once you've done that, reach out to our accreditation team to begin the process of getting your department accredited. If your department is accredited, the good news is there's nothing you need to do right this second. The accreditation team will be in touch with everybody to let you know the process of bringing this new curriculum on board. You will, however, need to develop a new training plan based on the 2022 curriculum. As I've mentioned, this curriculum has gone through significant overhaul, so you do need to revisit the 2022 curriculum and develop a new training plan. So you might like to start thinking about that now. However, to support you in thinking about developing that new training plan and bringing your new training on board, we will be continuing this conversation. Today is just a start. So if you've tuned into the webinar, that's a great start, and it will be available on the website in the coming weeks. We'll be holding a drop-in session next week about this time, 10 till 12. Myself and the accreditation team will be available for all of those 2 hours. So if you've got any questions, if you've got any queries about the new curriculum, about taking a trainee for 2022, please do pop along at any time and you've got an opportunity to ask those questions. We will be continuing those drop-in sessions, so that's not your only opportunity. We have one scheduled for August, one for September and one for November. So you've got plenty of opportunity to come back and talk to us in the future as you start to work with this new curriculum. All of the events will be posted on our website, so do keep an eye on the events section. As Steph mentioned, we're also focusing on a couple of the specialties that have seen the most radical overhaul through this process. So through August, we'll be talking through both histopathology and clinical engineering. So if you do have any specific questions on either of those specialties, you have an opportunity to come and discuss those on those dates. We are hoping we can run a larger event for you in the autumn. We are currently taking the temperature and just assessing the current situation as to how we do that, and we'll provide you with more details of that in the future. And as ever, alongside that, we will continue to develop our website content to support you in working with the new curriculum, so please do check back on our website. So while that's all from me today, you do have many more opportunities to continue the conversation with us as we put all of this hard work into practice. So again, I would like to say a huge thank you to everyone. So I'd like to say a huge thank you. I'd like to say I'm going to finish. Sorry, I'm getting some technical direction, which I'm not really coping with. I'm hoping you can hear me. I'd like to say a huge thank you to everybody that's been involved in this project, and everybody will be involved in rolling out this new curriculum. While we finish one project, this is just the beginning of this next phase and the beginning of the evolution of this curriculum. So as I say, this is all from me today, and I look forward to talking to you in the future. Thank you, everybody.
Thank you, Navina, Bernie and Chris for your time today, and thank you to everyone that has joined us on this webinar. For any additional information, please continue to refer to our website, and once again, thank you very much. Take care and goodbye.